People do ask about frozen shoulders. Okay, what is frozen shoulders? And then no one really know. Evidence says, okay, it might be systematic, it might be traumatic onset has happened, and then the conclusion is always going to be, we don't know. Is it right?
Yeah.
I mean, most of the things, all right? So obviously we follow the evidence-based studies. So as an osteopath, have you seen any frozen shoulders for this patient?
Yeah, I've seen quite a few of them.
What is the pattern you see in them? What happening when you do the active examination?
Well, they cannot really move it, especially if they are in sort of that acute stage.
Okay.
So they're really stiff, not much movement is happening at all, they're in a lot of pain, and they just normally don't know what's going on.
Okay, so they are in pain. They have also some kind of like a fear factors going on because it's painful. They just like a freeze. I think where the frozenness come, they stop moving around. Okay, so my experience is someone like had a past fracture or trauma related anything around on this area. Let's say old lady or gentleman fall on the ground, hit it, fracture, or not even fractures, multiple things has happened, and that was very sedentary. And then they went to doctors, they cut the x-ray, they might have some strain, not fractures, but then they have a fear of protection. And the doctor say, the GP say, okay, we need to keep everything intact, hold this position for a while, and either the painkiller and stay away. So that they stay away, keep it for long because of painful shoulders area. They don't want to move, and then there is no exercise rehab going on or any type of rehab going on. And then when they take the sling off, and then they realize I'm not able to lift anymore.
Okay, so that's an interesting point that you bring up, because that's what happens with a lot of frozen shoulder patients.
Yeah.
And actually, depending on different stages where you're at, we can give you tailored mobility exercises. Yeah. So within a very small range, remember frozen shoulder patients, they cannot move much. There's a thickening of a lot of ligaments and tendons which stops this. But with really incremental degrees of movement, that's going to help the rehabilitation. So they're not going to, suddenly take that sort of cast off of being immobile and they cannot move the arm. Yeah. So that's what we really do here.
So the few other scenarios, or also there are the Facebook group Frozen Shoulders. They asked me some question about it. So the one of them thinks, okay, what should I do pre-operation and post-operation? Okay, so the pre-operation is rehabilitation needed. It's kind of like a more preventative rehabilitation, because when those patients go to operation, you want their blood circulation, synovial fluid is still moving, maybe not able to focally local in this area. Maybe you can get good movement on the upper spine, the thoracic spine, on the neck area, and then you can get like a, prepare you for a operation. So that they get the operation, they are pretty healthier because they done the rehabilitation for the operation. And after the post-operation, so we need to get into exercise regime, okay, rehabilitation. Obviously, we consider about the pain level, we consider the range of movement, and normally the range of movement, I mean, they cannot overtake more than the 90 degrees, and very limited, and movement very painful. The little movements is the key to the healing. Traumatic onset, rugby player, hit together, crack it, again sometimes you crack the clavicular joint, and again you got a lot of pain going on, you didn't do rehabilitation, you didn't move the shoulders overhead, and then everything around the capsules, ligaments, tendons, all the muscles, tissues. I mean, even the, nerve system, talking about the bronchial plexus. I say to people, they become a more blind, like a sensory reception and motor reception.
Oh,
like it's not able to.
Like dysregulated.
Dysfunction. Okay, cool. So other question are, okay, how do we rule in or rule out with anything going on my neck, cervical spine, and with my shoulders? My thought, they are very, communicate and they work each other. And then people obviously, we got protrusion, herniation, some impingement through the bronchial plexus. Can you tell something about what your thoughts, so it will be helpful for the people?
Yeah, sure. So obviously these kinds of disc injuries are very common. So how do we tell the difference to a frozen shoulder? First of all, with our consultation, we ask a lot of questions about the problem. Does it come on movement? Is it when you're engaging a certain muscle? Is it, for example, when you're coughing or sneezing, which would be more of a disc kind of problem? Any sort of a tingling happening, pins and needles going into the hand, which nerves are getting affected, for example? Yeah,
normally people, when they come first around the tree, we kind of make a decision of which, is it C7, C6, C5, where it goes, which line, and they're saying, okay, C7, and then where did it come in C7? Because a lot of people say C7, C7, C7. What is C7? Cervical 7.
Yeah,
so
sure.
C7 and C8 nerves.
In the neck, we call it cervical spine. I'm showing on a Marat here. So this is neck. This is a cervical spine. There's a 7 vertebrae going through, so I can count and show you. So we have the C1, which is very high. We have C2, 3, 4, 5, 6, 7. So 7 is literally at the base of that neck, in between the shoulders, as it goes into your mid back and ribs. Okay.
And then if I move, you might kind of feel something going on there. Or
for sure, all the structures are connected. If you have anything in the neck, a disc injury affecting this segment into C7, it can go into the forearm, into the hand. So that's why we look at these things.
Kind of the pathologies. Okay, is anything referral pain? Okay. We cough and sneezing. What is the postural position? Or is there some spatial tests? Sterling tests. So kind of doing this kind of things, isn't it?
And also the family history is very important with a frozen shoulder. Has your mother or father had it before? If you have diabetes, very high risk of the frozen shoulder. Any hormonal changes that have been going on, so that's why a thorough consultation is essential.
So anything kind of predisposing factors, so that what Julia said, diabetics, is that it's kind of okay, your hormonal level, your insulin level, your glucose level, not really good condition, and then it affect your circulation and affect your healing stage. Anything you want to add top of all those things regarding the frozen shoulders? I'm just gonna say a few things, but go on.
Well, I guess if you are unsure, if you have a shoulder pain and you're unsure what's going on, I would recommend coming in and having one of us osteopaths have a look at you, have experience in this kind of area, so then you can get the treatment that you need.
Cool. So the additional, you already mentioned, so that with the frozen shoulders, one thing, even you do active and passive examination, your shoulders is limited. If you have sprain, strain, any muscle dysfunction going on, when you do your active range of movement, let's say for example, my deltoids is lifting my arm, okay, or infraspinatus, my rotator cuff. if I go this, I'm not able to do this, or very limited will go, isn't it? But in the kind of like a frozen shoulders position, you kind of pretty much stuck. And what I observe my patient, I see this.
Yeah, elevated.
Yeah, so the evidence talk about if your humeral head, so this is humerus, your humeral head is not on the good place on the socket, in your upper scapula in a good position, and you there, you're not able to lift, and then you're not able to lift. So when you bring it down, obviously able to bring it down with no lot of pain, and then hopefully the start moves up. So the first things I'm kind of really focusing on as an osteopath: shoulder positioning, head positioning, and then nice and relaxed. I try to engage a lot of muscles underneath, teres minor, your lats and lower trapezius type of things, and then get movements going on, shoulders down, and then focus my GH, glenohumeral, and then move up and down. And then we just give people some pendulum kind of movement, which we will be putting the videos for shoulders wrap exercise on the YouTube. So thank you very much for being here, watching us. It's been a long video. Julia will be editing all. Thank you. Bye.